The Essential Newborn Care.
Essential Newborn Care, ENC. How was the ENC protocol developed? The ENC protocol was developed the Newborn Care Technical Working Group, TWG, that conducted a systematic search and critical appraisal of foreign and local medical and allied health literature on practices in the immediate newborn period. An evidence-based draft was then developed and reviewed by the Department of Health, United Nations Children's Fund, UNICEF, United Nations Population Fund, UNFPA, the Philippine Obstetrical and Gynecological Society, POGS, the Philippine Society of Newborn Medicine, PSNBM, a subspecialty society of the Philippine Pediatric Society, PPS, other health professional organizations/associations, Save the Children, the academe, and other stakeholders. What do these for? 4. Time-bound. Interventions due to the newborn. 1. Immediate and thorough drying of the newborn prevents hypothermia, which is extremely important to newborn survival. 2. Keeping the mother and baby in uninterrupted skin-to-skin contact prevents hypothermia, hypoglycemia, and sepsis, increases colonization with protective bacterial flora, and improved breastfeeding initiation and exclusivity. What has the government done to ensure implementation of the Essential Newborn Care Protocol? The signing of the Administrative Order 2009-0025 last December 1, 2009 institutionalizes policies and guidelines for government and private health facilities to adopt the Essential Newborn Care Protocol. Advocacy and dissemination for it have been done since its launch. Scale-up implementation in all health facilities and social marketing are both in the pipeline to ensure that the policy is implemented all over the country. What is the relationship of the ENC protocol with regard to the maternal, newborn, and child health nutrition, MNCHN, strategy? The maternal, newborn, child health and nutrition, MNCHN, strategy is in line with the DOE Administrative Order 2008-0029 that seeks to rapidly reduce maternal and newborn morbidity and mortality. Foremost to this is the provision of basic and comprehensive emergency obstetric and newborn care, BEMONC and CEMAN, capability of health facilities to meet the UN MDGs 4 and 5. Newborn care has been incorporated in the provision of these service capabilities. The Administrative Order 2009-0025 formalized the adoption of policies and guidelines on essential newborn care. What is the relationship of the ENC protocol with regard to the Mother-Baby Friendly Hospital Initiative, MFHI, Infant and Young Child Feeding Strategy, and the Republic Act 10028? The ENC protocol seeks to provide a firm foundation for an environment that complies with the 10 Steps to Successful Breastfeeding of the Mother-Baby Friendly Hospital Initiative, MFHI, breastfeeding initiation crucial to the IYCF WHO global strategy and in the implementation of the RA 10028. 3. Properly timed cord clamping and cutting until the umbilical cord pulsation stops decreases anemia in 1 out of every 7 term babies and 1 out of every 3 preterm babies. It also prevents brain, intraventricular, hemorrhage in 1 of 2 preterm babies. 4. Breastfeeding initiation within the first hour of life prevents an estimated 19.1% of all neonatal deaths. Time band, at perineal bulging. Prepare for the delivery. Check temperature of the delivery room. 25 to 28 degrees centigrade. Free of air drafts. Notify appropriate staff. Arrange needed supplies in linear fashion. Check resuscitation equipment. Wash hands with clean water and soap. Double glove just before delivery. Time band, within first 30 seconds. Immediate thorough drying. Call out the time of birth. Dry the newborn thoroughly for at least 30 seconds. Wipe the eyes, face, head, front and back arms and legs. Remove the wet cloth. Do a quick check of breathing while drying. Notes, during the first seconds. Do not ventilate unless the baby is floppy/limp and not breathing. Do not suction unless the mouth/nose are blocked with secretions or other material. Time band, 0 to 3 minutes. Immediate thorough drying. Notes. Do not wipe off vernix caseosa. Do not bathe the newborn. Do not do footprinting. No slapping. No hanging upside down. No squeezing of chest. Time band, after 30 seconds of drying. Early skin, 2, skin contact. Number if newborn is breathing or crying. Position the newborn prone on the mother's abdomen or chest. Cover the newborn's back with a dry blanket. Cover the newborn's head with a bonnet. Notes: avoid any manipulation, e.g. routine suctioning that may cause trauma or infection. Place identification band on ankle, not wrist. Skin-to-skin contact is double even for C/S newborns. Time band, 1 to 3 minutes. Properly timed cord clamping. Remove the first set of gloves. After the umbilical pulsations has stopped, clamp the cord using the sterile plastic clamp. Or tie it 2 cm from the umbilical base. Clamp again at 5 cm from the base. Cut the cord close to the plastic clamp. Notes: do not milk the cord towards the baby. After the first clamp, you may strip the cord of blood before applying the second clamp. Cut the cord close to the plastic clamp so that there is no need for a second trim. Do not apply any substance onto the cord. Time band, within 90 minutes. Non-separation of newborn from mother for early breastfeeding. Leave the newborn in skin-to-skin contact. Observe for feeding cues including tonguing, licking, rooting. Point these out to the mother and encourage her to nudge the newborn towards the breast. Counsel on positioning. Newborn's neck is not flexed. Newborn is facing the breast. Newborn's body is close to mother's body. Newborn's whole body is supported. Counsel on attachment and suckling. Mouth wide open. Lower lip turned outwards. Baby's chin touching breast. Suckling is slow, deep with some pauses. Notes: minimize handling by health workers. Do not give sugar water, formula, or other prelactials. Do not give bottles or pacifiers. Do not throw colostrums. Weighing, bathing, eye care, examinations, injections, hepatitis B, BCG, should be done after the first full breastfeed is completed. Postpone washing until at least 6 hours. Notes: minimize handling by health workers. Do not give sugar water, formula, or other prelactials. Do not give bottles or pacifiers. Do not throw colostrums. Weighing, bathing, eye care, examinations, injections, hepatitis B, BCG, should be done after the first full breastfeed is completed. Postpone washing until at least 6 hours.
Newborn or neonate. A baby in the neonatal period, the first 28 days of life. Nursing diagnoses. Ineffective airway clearance related to mucus in airway. Ineffective thermoregulation related to heat loss from exposure in birthing room. Imbalanced nutrition, less than body requirements, related to poor sucking reflex. Readiness for enhanced family coping related to birth of planned infant. Health-seeking behaviors related to newborn needs. The average newborn. Studies have shown that many newborn lives can be saved by the use of interventions that require simple technology. The majority of these interventions can be effectively provided by a single skilled birth attendant caring for the mother and the newborn. Care of all newborns includes immediate and thorough drying, skin-to-skin contact of the newborn with the mother, cord clamping and cutting after the first minutes after birth, early initiation of breastfeeding, and exclusive breastfeeding. Newborns who do not start breathing on their own by 1 minute after birth should receive positive pressure ventilation with room air by a self-inflating bag and mask. After the first hour of life, newborns should receive eye care, vitamin K, and recommended immunizations, birth dose of OPV and hepatitis B vaccine. They should be assessed for birth weight, gestational age, congenital defects, and signs of newborn illness. Special care should be provided for sick newborns, those who are preterm and/or low birth weight, and those who are exposed or infected by HIV or have congenital syphilis. This are the newborn priorities in the first days of life and as follows: initiation and maintenance of respirations. Establishment of extrauterine circulation. Control of body temperature. Adequate nourishment. Waste elimination. Prevention of infection. Infant-parent relationship. Developmental care. Objectives: to establish and maintain respiration, to ensure warmth, to prevent infection, to provide care to the eyes, to provide care to the umbilical cord, to provide care to the skin, to make observation and documentation and to make identification and transfer. Care of the newborn at the Dr. A. Establish and maintain respiration. Suctioning. Turn head to one side. Suction gently and quickly. Suction the mouth first before the nose. Test patency of the airway. Proper position. Ensure an open airway. Do not hyperextend head. Place neonate supine. Head slightly extended. B. Maintain appropriate body temperature. Blot dry or rub dry the infant. 1. Wrap the newborn immediately. 2. Wrap him warmly. 3. Put him under a drop light. Warmth. At birth, the newborn must begin thermoregulation, maintenance of body temperature. 3 factors: heat production, heat retention, heat loss, heat production, thermogenesis, through general metabolism, muscular activity, non-shivering thermogenesis, unique to the newborn. Newborns rarely shiver as adults due to increased heat production. Shivering in newborns indicates that the metabolic rate has already doubled. Infant in a cool environment requires more heat. Metabolic rate increases, producing more heat. Heat production. Newborn may cry and have muscular activity when cold, but there is no voluntary control of muscular activity. If the newborn's temperature is not adequately raised through increased metabolism, non-shivering thermogenesis, the metabolism of brown fat begins. Non-shivering thermogenesis, the metabolism of brown fat. Brown fat. Special tissue/fat found only in newborns. Highly vascularized, giving it a brown color. Oxidized to produce or conserve heat. Increasing metabolism. Located at the back of the neck, intrascapular region, thorax, around the kidneys and adrenals, in the axilla, around the heart and abdominal aorta and perineal area. Once the brown fat has been metabolized, the infant no longer has this method of heat production available. 2. Heat retention. Newborns retain heat by staying in a flexed position. Reduces the area of skin exposed to the environmental temperature, thus decreasing heat loss. Peripheral vasoconstriction retains heat. Conservation of heat. 1. Brown fat. 2. Kangaroo care, placing the newborn against the mother's skin and then covering the newborn. Helps to transfer heat from the mother to the newborn, thus, conserving heat loss. 3. Heat loss. Newborn. Thin skin with blood vessels close to the surface and little subcutaneous fat to prevent heat loss. Cold stress, excessive heat loss, increased metabolism. A. Significant increase in need for oxygen. A. Newborn may experience hypoxia. There may not be enough oxygen for the metabolic rate to increase, and the newborn will not be able to maintain body temperature. Effects of cold stress: temperature of less than 36.5. 1. Metabolic acidosis. Increased BMR, anaerobic glycolysis, increased acid production, metabolic acidosis. 2. Hypoglycemia. Increased energy requirement to produce heat. Glucose necessary for increased metabolism is made available when glycogen stores are converted to glucose. If the glycogen is depleted, hypoglycemia results. 4. Mechanisms of heat loss. 1. Convection, flow of heat from the newborn's body surface to cooler surrounding air. 2. Radiation, transfer of body heat to cooler solid object not in contact with the baby. 3. Conduction, Transfer of body heat to cooler solid object in contact with the baby. 4. Evaporation, loss of heat through conversion of liquid to a vapor. Other causes of heat loss. 1. Insulation in newborn is not effective, little subcutaneous fat. 2. Shivering is not present. IMMEDI at E. ASSESSMENT. OFTHE. NEWBORN. Assessment for well-being, APGAR score. Appearance, color, least important. Pulse rate, most important. G-RMACE, reflex activity, irritability. Activity, muscle tone. R aspiration. First minute, general condition, neuro/respi/circulatory check. Fifth minute, adjustment to extrauterine life. APGAR scoring system, interpretation of results. Score, 9, highest score, 10, perfect score. 0 to 3 poor, serious, severely depressed, need CPR. 4 to 6, fair, guarded, moderately depressed, need suction. 7 to 10, good, healthy. Silverman-Anderson scoring, respiratory distress, 0, no respiratory distress. 1 to 3 slight distress. 4 to 6 moderate distress. 7 to 10 seriously distressed. Immediate care of the newborn in the nursery.
Note that ID bands of mother and baby are matched. Special care. 1. Initial bath temp stabilizes 36.5 degrees C 6 to 8 hours after birth. Vernix caseosa, use oil. Warm water during the first week. Don't use soap. 2. First bath. For the next 10 days to 2 weeks, sponge bath. Newborn are not generally given tub bath until the cord has fallen off and healing is complete. Nurse giving the first bath to newborn must wear gloves to comply with standard precautions regarding contact with blood or body fluids. 3. Taking the temperature. Maintain temperature to prevent cold stress. Use rectal route. Meconium, 24 to 48 hours. Initial cord dressing. Inspect for A.V.A. Aseptic technique. Povidone, betadine, 70% isopropyl alcohol, prevent tetanus neonatorum and omphalitis, streptococcal and staphylococcal. Signs of omphalitis. Reddening of the area. Fever. Discharge or foul smell. Application of sterile cord clamp, prevent bleeding within first 24 hours, omphalangia. 4. Creeds prophylaxis. Asterisk legal requirement for all NB, US. Asterisk infection, acquired during delivery from a mother with untreated gonorrhea. Medications. A. Ophthalmic drops silver nitrate or AGNO3 1% 1 to 2 drops. Lower conjunctival sac. Wash with sterile NSS after 1 minute to prevent chemical conjunctivitis. B. Ointment. Terramycin. Gentamicin. Chloramphenicol. Erythromycin. Erythromycin. Pull eyelids downward. 0.5 to 1 cm. Inner to outer canthus. Wipe excess away. 6. Take anthropometric measurements, vital statistics. 5. Vitamin K injection. Sterile GIT. Facilitates production of clotting factor. 1 mg aquamephetone. IM, lateral anterior thigh, vastus lateralis. 6. Take anthropometric measurements, vital statistics. Anthropometric measurement. Length, mature female neonate 53 cm, 20.9 in, mature male 54 cm, 21.3 in. Head circumference, mature newborn 34-35 cm, 13.5 to 14 in. Measure with the tape measure drawn across the center of the forehead and around the most prominent portion of the posterior head. Chest circumference, term newborn 2 cm less than head circumference, measured at the level of the nipple. Vital signs. Physical assessment. 1. Vital signs. A pulse. 1 full minute, use apical pulse. Irregular, rapid 160-180 at birth. Normal, 120-160 bpm. During sleep, 90 to 110 bpm. If crying, up to 180 bpm. Pulse, heart rate in utero 120 T0160 bpm. After 1 HR newborn settles, heart rate stabilizes to an average of 120 to 140 bpm. Remains irregular because of immaturity of cardiac regulatory center in the medulla. Crying, rate might increase to 180 bpm, 90 to 110 bpm during sleep. Femoral pulses are more appreciated than radial and temporal pulses. Always palpate for the femoral pulses, their absence suggests coarctation of aorta. B. Respirations. 1 full minute. Irregular, shallow, rapid W/brief apnea expels 15ths. 60 to 80 breaths/min at birth. Normal, 30-60/minute. Respiration, average is 30 to 60 breaths per minute. Respiratory rate, RHYTHMN, depth are likely to be irregular and short periods of apnea, periodic respiration, are normal. Coughing and sneezing are present at birth to clear the airway. Newborns are obligate nose breathers. C. Blood pressure, not usually measured. Not routinely obtained except for suspicion of coarctation of the aorta. 80-60/45-40 mmHg at birth. 100/50 mmHg at day 10. D. Temperature. Normal range, 36.5 C 37.5 C, axilla. Axillary, 36.4 C 37.2 C. Skin, 36.0 C 36.5 C. Rectal, 36.6 C 37.2 C. Temperature 37.2 at birth. Crying, increase body temperature slightly. Radiant warmer, falsely increase axillary temperature.